Welcome to Scrubbed In and Speaking Out, a podcast by the Registered Nurses Union of Newfoundland and Labrador, where we dive into the issues facing nurses and the advocacy shaping the future of public healthcare. I'm Dan Williams, Digital Communications Coordinator with RNU and I'm here with the President of the Registered Nurses Union, Yvette Coffey.
Hi, Dan, and welcome, everyone.
So today, I guess we just thought we would do sort of a broad overview of some of the advocacy work that Yvette, you and staff and all our volunteers are working towards. So maybe we'll just start with your own self and talk a little bit about when we say the advocacy work that you're doing, what does that look like exactly?
Advocacy encompasses a whole lot. So seeing me out there in the media talking on the airways, VOCM, CBC, doing this podcast, that's part of advocacy on behalf of our members. But also part of that is regular meetings with the leadership of the Newfoundland and Labrador Health Services. We meet regularly with the Department of Health Community Services. Here in Newfoundland and Labrador, we are unique compared to our counterparts across the country. We have access to our Minister of Health. We have access to deputy ministers, assistant deputy ministers. We have access to the Premier. Unlike a lot of our counterparts who can't even get a meeting with their Ministers of Health. So we take advantage and take the opportunity to advocate on behalf of our members, to talk about the burning issues that we're hearing from the front line. So that's one part of the advocacy. The other part is meeting with stakeholders such as the college, CRNNL, to talk about legislative changes to the Nurse Act here in Newfoundland and Labrador, for instance, when RN prescribing became legislated last year. Also talking about changes to nurse practitioner education, which is coming in 2026, and what impacts that has. Also about regulatory matters. Even trade talks that are happening right now between all the provinces and the federal government. And what does that mean for registered nurses and licensure here in this province and employment of registered nurses and nurse practitioners and other healthcare providers? We also, we're involved in a lot of advocacy work when it comes to our nurse practitioners. So we meet with Nurse Practitioner Association of Newfoundland and Labrador. We meet with nurse practitioners. We have a project underway with the job evaluation system classifications for nurse practitioners. At the preface of all of that is equal pay for equal work. And nurse practitioners and registered nurses all deserve equal pay for equal work. We are a female-dominated profession, but we also need to be paid and compensated at the right wages, not the lowest in Canada. And we have to stop comparing ourselves to the Atlantic provinces, which is something historically we have always done when it comes to collective bargaining and that. Yes, we do jurisdictional scans across the country, but our nurse practitioners here in this province have the highest scope of practice of all nurse practitioners in this country. We have said that very clearly to government, to the health authority. We need to continue our advocacy work on a funding model for nurse practitioners. There is some disagreement out there about whether or not RNU has actually advocated for nurse practitioners when it comes to a funding model. And that came from comments that were made in the House of Assembly last year. And I just want to be very clear. We have never said we do not support a funding model for nurse practitioners. What we have said is we want a funding model that works. And we know that the old MCP billing and fee-for-service is not working. And that's why the Newfoundland and Labrador Medical Association actually negotiated a blended cap model. And the health authority and government, everyone is trying to move away from fee-for-service. So what we need is something new, something that is unique for nurse practitioners and their practice. And we continue to advocate for that at all levels of government. One of the other things that we have done is we've had private agreements negotiated. So David Hammond, our executive director, has been instrumental in negotiating these private agreements with the employer and with Treasury Board, with government, so that nurse practitioners, so I'm a registered nurse. I do my nurse practitioner education, and then I become a nurse practitioner. The way our salary scales go right now, that nurse practitioner would actually slot into a pay scale based on the RN role they were already in. Instead of going step for step, they fit in wherever that wage puts them. We negotiated a private agreement so that a nurse practitioner, when they begin practicing here in this province, will actually go step for step of where they were on the RN scale. So if you're on step 6 as a registered nurse, you go to step 6 of the nurse practitioner salary scale. That is a big win for nurse practitioners. And of course, we will be looking to expand that to registered nurses as well. We also negotiated a private agreement for paid leave for nurse practitioners for the job evaluation project. We do acknowledge this has taken longer than anticipated by all parties, the classification process. But we all have to, share the blame with that. First, there had to be education for personnel with NLHS. Then there had to be education with our nurse practitioners who were volunteered to do the PDQs. And then there was delays in meeting the deadlines to get those PDQs in. So right now, the biggest thing, all the PDQs are in, and what we're looking at now is the retroactivity of this, and we are already in discussions with Treasury Board about that, so more to come on that. We also advocate for safe patient care and safe care, safe workplaces for our registered nurses and nurse practitioners and all healthcare professionals. You've heard me very loudly call for an independent health sector safety council. Well, we didn't get it. But what we did get is a tripartite committee. It's called a council. So between the Federation of Labour Healthcare Union presidents, so we have CUPE, NAPE, RNU and Allied Health at the table, along with the leadership of NLHS, along with reps from Workplace NL. And they have agreed to hire 2 facilitators to embed into NLHS to work on, first of all, addressing the violence and workplace injuries that we're seeing, because every second day in this province, a registered nurse files a claim with Workplace NL. Those are staggering statistics. The violence, myself and David are having to get involved with our labour relations officers and our members on a weekly basis now with incidents that are happening in the workplace, making sure that our members are protected and that they receive the resources and the support they need. We also are involved in advocating for an expansion of the Labrador travel locum. As you know, it's been extended till the end of this contract, at least. And by all records, it was successful. It is successful. It's proving to be cost efficient. It's far cheaper to pay $25 an hour extra to a registered nurse or nurse practitioner than it is to pay $400,000 for one registered nurse with a private agency. So you just got to compare bang for your buck. And our members are the better solution here. So we're looking at expanding that now out to the island, rural and remote parts of Newfoundland and Labrador. We're actually advocating that NLHS expand this locum to any area that they deem necessary for staffing, just like it works in the Labrador zone. So when we talk about Gander having 30 private agency nurses there, for me, that's a priority for a travel locum right there. And it would cost far less, and it would give our members the opportunity to travel around Newfoundland and Labrador and experience nursing in different areas and different fields throughout the province. So that's some of the things, not all. And I know I'm long-winded, but I'm very passionate about everything when it comes to registered nurses and nurse practitioners, trying to keep you safe at work. You know, being at the employer and saying, no, not good enough. Did you do this? Did you do that? We're involved in several different areas of the province, myself and David, with our labour relations officers, where we're not getting answers on the ground level. And one of my biggest beefs with the employer, and I tell this to government and I tell this to the leaders of NLHS, why are you not listening to our frontline members? They are the ones experiencing the issues, experiencing the trauma of violence, short staffing, mandating overtime, 24-hour shifts. Why are you not listening to them and the solutions they are bringing forward? You are the experts. Why does it take Yvette Coffey or David Hammond getting involved in a meeting to get action? It's one of my pet peeves. It is something I'm talking to government about, to the Department of Health Community Services. At the lowest level possible, these things could be handled. And it shouldn't take me having to go to a meeting to get resolutions in place.
Okay, so just so much to unpack there. People see you in the media, but also important to point out all of the work that you're doing behind the scenes to improve the lives of both nurse practitioners, of course, and registered nurses. We've also tried to make the point, I think, that all the recruitment in the world won't matter if we don't retain our nurses. So retention challenges, I guess maybe the violence obviously is a big one. What other retention challenges are we seeing? Like, why are nurses leaving the workforce even after a year, 2 years, 3 years? What are we hearing?
So it's the inability to get time off, and we're still hearing that. It's, you know, when the health authority opens beds but doesn't have the resources, doesn't have the staff to open those beds, that don't just impact that unit that they open or those beds they open. That impacts the whole facility. So I know we're dealing with issues right now, and it's called surge and overcapacity. Our emergency departments are overflowing. We have ambulances unable to offload their patients and give report to the emergency room staff because there's just nowhere to put them. And the number of admitted patients. We recognize the need for more beds. And we also recognize that patients are, once they're admitted, are better off in an inpatient unit, receiving the appropriate care that they need, not on a stretcher in the emergency room. But they're not better served either on a stretcher in a hallway, on an inpatient unit, or in a physiotherapy room, which is happening in some areas. You know, you don't have the proper occupational health and safety regulations, like for egress, oxygen supply, suction supply in the walls. You're depending on portable stuff, medications, privacy for the patients, ergonomics when you're trying to move a patient on a stretcher. I mean, our whole premise is to care for a patient holistically and protect their dignity while we're doing that. And today, that's not what's happening. We have already told government and we've told the health authority, we're willing to work with you. But you can't open beds without having the proper resources and supports in place ahead of time. Because right now what we're hearing is there's people being denied annual leave because you may have to float to a new transition unit. Or you may have to float because they only have private agency nurses down there and we need someone to go down there and be in charge of that unit. That's not good enough. So it's impacting more than just the emergency departments in our province, and it's lack of primary health care. We go back to the nurse practitioner thing. If we empowered nurse practitioners to practice to their full scope, to have nurse practitioner-led clinics throughout urban and rural areas of this province, we would see a decline in the number of patients showing up in that emergency departments who need a prescription, who haven't seen a physician or a nurse practitioner or any other primary healthcare provider for that matter, be it a psychologist, be it a physiotherapist, because they don't have access. So something like diabetes that could have been diagnosed a year ago, we now have that compounded with a foot ulcer, or vision issues or cardiac issues. Nursing knows that diabetes affects every single organ in your body. So if we can get to the people of Newfoundland and Labrador before they end up having to go to an emergency department, we'll resolve some of those issues. So it's like a domino effect. The lack of primary health care leads to overcrowded emergency departments, leads to admitted patients being on stretchers in hallways or stretchers in inpatient units or physiotherapy rooms. We see nurses who are working and caring for all these patients short-staffed on a daily basis. I've heard the comment from management, we look at the whole building and yeah, it's better to have every single unit down a registered nurse than to have one unit get their holidays and the other units denied. So there's give and take from all sides, but there needs to be a bigger plan in place, and it needs to be an all-encompassing plan. You can't just look at one part of the system if we want to come up with real solutions that will work and will benefit both our members and the people that we care for. The mandating of overtime has got to stop. We have provided solutions and said, listen, put a call out. Put out an expression of interest to everybody in a big facility. Why are you just going back to the same people? And it takes several meetings to get that through. And we're still dealing with that in particular areas of the province. Our LROs, our Labour Relations Officers, are inundated with calls such as these. One of the biggest things that I'm really concerned about right now is the occupational health and safety concerns that are not being addressed in the workplaces. And that includes the violence. I know you've all seen recently we've had people charged, patients or visitors, in emergency rooms where they were violent, where, there was whatever the charges were, but they either assaulted nurses or staff, or there was destruction of property. However, there's a lot more to the occupational health and safety concerns around violence than police presence and pressing charges. We need to do more education with our members. This is part of our advocacy with our education plan with our shop stewards and our branch executives. Members need to know that you are no less than any other person going to a job on a daily basis, and that you can avail of all the services of occupational health and safety, of workplace NL. You have the right to refuse unsafe work. And we have to start saying no. And that is our biggest takeaway from our Canadian Federation of Nurses Unions convention that our volunteers just attended in Ontario in June. We have to start saying no. No to unsafe working conditions, no to mandatory overtime, no to 24-hour shifts. So there's work being done behind the scenes on the documentation around 16+ hour shifts now that goes to the Department of Health. But that's not going to stop those shifts. What's going to stop those shifts is better solutions from the employer based on what our members are telling them, based on what our union is telling the employer. But we need your help with this as well. When we talk to the college and we ask about hours of work and what's the maximum number of hours or maximum number of shifts, 12-hour shifts in a row, that a registered nurse or a nurse practitioner should be doing, there is no standard. There is no policy that says, Yvette, you can only work 16 hours. Max, that's it. The New Brunswick Nurses Union does have a clause in their collective agreement that says maximum of 16 hours. That's the only collective agreement that we're aware of across the country that has that clause in there. But we're talking about this nationally. There needs to be standards. And, we met with the new MP, Tom Osborne, yesterday, and we actually had a discussion about that. Firefighters have standards. Truck drivers have standards about hours of work. Pilots have a maximum number of hours. I mean, what bigger safety issue is there than we're making life and death decisions about people? All the time we're working. So we are doing advocacy around that. It is a constant struggle and a constant fight, of course, to make any changes in our system. But we will continue to advocate that this can't keep happening. Nurses have a right to refuse unsafe work. The college says the impetus and the onus is on you as a registered nurse or nurse practitioner to assess your own ability, your fitness to perform your duties. And when you feel that you are too exhausted and your brain is fuzzy, you're the one that is held accountable to your license. You are practicing under your own license. And we need to start empowering you as registered nurses and nurse practitioners to say, enough is enough. No, I can't keep going, and this is not safe.
And how does a nurse who's already worked 12 hours and they're looking at their patients and know what needs to be done next to just walk away? I think that's the hardest part. And I think, well, first of all, let's just back up for a second, because there may be listeners who maybe there's people out there that haven't heard of mandation or what it means. When we're talking about mandatory overtime, and we're talking about mandatory overtime after a nurse has already worked a 12-hour shift, and then to be mandated to work potentially another 12-hour shift. So now we're talking about people who are on the floor for up to 24 hours. And this is happening, and we know it's happening from our members. So to get back to that now, how do we empower our members? And this is something that we need to probably do a better job at, to be able to stand up and say, no, that's unsafe.
That's going to be part of, when you get in those situations, you need to talk to your shop stewards or your branch executive, or call us here at the office. Talk to a labor relations officer, because you do have rights. And our labor relations officers can walk you through the right to refuse unsafe work. We are pushing the employers to have protocols in place to mitigate the need for mandatory overtime and 24-hour shifts. They just got to start listening to us, basically. But it's that guilt factor. Mm-hmm. And it's always been that guilt factor about walking away. Well, if I'm too exhausted and not thinking properly and I make a mistake, that's the well-being of the patient that's at risk. But at the end of the day, every decision that's being made by a registered nurse or nurse practitioner, can I continue on at 16 hours? I can't even put a full sentence together. Am I really fit? Each one of us has to make that determination ourselves, but we need to document that we have stated this to the employer, and we have said, no, I am not fit to practice at the moment related to fatigue. We need to start filling out occurrence reports, professional practice, and peers reports. And I know I get it all the time. People do not want to stay at the end of their shift and fill out reports. But that is what covers you. That is your paper trail. We know as registered nurses and nurse practitioners, not charted, not documented, not done. So if we don't document issues, they're not issues. So we need your help there with the documentation piece, with letting us know when there's all this mandatory overtime and 24-hour shifts going on. Let your union reps know, your volunteers in the workplace, your branch executives, your regional reps on the board of directors, because a lot of times that's where we're hearing the information, as well as from our labor relations officers when you make that call here. And, part of the education with our shop stewards and branch executives, we are going to be doing a focus this year on occupational health and safety and our rights under the legislation to refuse unsafe work.
Excellent. So maybe we just finish off with a message to decision makers in the health system about, obviously we got a little into mandation here, about what they need to do to change this right now.
We talk about the core staffing review that is starting this fall and should be done by the spring. Right now, we are staffing our institutions, our communities, our long-term care facilities on data from 40 years ago. We know that our patients are sicker. We know that we only have the sickest of the sickest that are admitted in our institutions, in our hospitals, in our acute care settings. We know that the acuity of patients going out to the community is way higher than it was 40 years ago. And we've been telling government and we've been telling the health authority, you need to overhire. You need to meet people where they're at as well, such as new graduates. So we just did sign, like an example of that is thinking outside the box. How can we offer flexibility to people to get them to take a permanent full-time position? And one thing we just did is sign a private agreement allowing someone to live in St. John's but actually hold a permanent position in Labrador. So, or a permanent position, say, Bonavista, Harbour Breton, Burgeo. They fly in or drive in and they work for 2 weeks straight and then they're off for the other 2 weeks of the month. That's their permanent position. They get their, public service pension plan. They get healthcare benefits. They get all the benefits of a permanent healthcare employee. Permanent full-time employee. So that's one of the ways, thinking outside the box, meeting people where they're at. If you got a house in Gander and you don't want to move and you're just graduating in Gander, that's an opportunity for you to be able to take a job anywhere in the province that they deem is very hard to fill and hard to recruit. So we're working on it. We're coming up with ideas, but come talk to us. Come tell us what your life as a registered nurse or nurse practitioner is where you're at, and come with the solutions that you feel will work for your area and your worksite.
Thanks so much, Yvette. I think we covered a lot of territory and there's still a lot more to go. And thanks to our listeners for tuning in to Scrubbed In and Speaking Out. Don't forget to follow or subscribe for more conversations about nursing in Newfoundland and Labrador.
Thank you all for listening. Thanks, Dan.
Thank you, Yvette.